So I had lost a total of 120 pounds. I was off my hypertension meds completely. Plantar fasciitis, reflux, chronic pain, improved neuropathy symptoms, long list of things that have improved that. Most of them I didn't even expect. Nowadays, 80-90% of the patients I see, the first thing I'm thinking is, okay, we need to change the diet. And on the third day of doing only meat, I woke up one day and I was like, absolutely, from the moment I woke up, not hungry. I've had 2 patients literally tell me, I'd rather die than change the way I eat. He's someone who's known me for 28 years. He saw me at my maximum weight. And after losing over 100 pounds, he never even asked how I did it.
All right, today we're going to be speaking with Nelson here, talking about some of the successes he's had with diet. So anyway, Nelson, welcome. Thanks for doing this. You said you're down in Florida. Give us a little bit about your background and I guess maybe start telling us your story if you don't mind.
Sure. Thank you for having me. My name is Nelson Vazquez. I'm a medical doctor for quite a while. This year will be 40 years since I graduated from medical school. And I have always struggled with weight, among other things. In 1991, 92, I hit 320 pounds. And at that time, I did read an Atkins book, put it into practice, lost 40 to 60 pounds or something like that. But of course, I didn't stick with it. And throughout the years, continued to struggle with that. Since then, I have also been giving advice to my patients on low carb. Basically, whenever I deal with patients with diabetes or blood sugar problems or prediabetes, diabetes, or anything else, my first advice is go low carb, get rid of the breads, the potatoes, the sugars, and all that. But about the end of September, so about 19, 20, 21 months ago, I was back at 305 to 310 pounds, and I said, I got to do something about it. Plus had diabetes and a multiple other list of chronic problems. I've lost over 100 pounds since then, 120 altogether since my heaviest.
Yeah, I think when I met you, you certainly weren't 300 and something pounds, so you definitely have lost quite a bit there. So how did you lose the additional 100 pounds now? What was the impetus for doing? Obviously, it's not healthy as a physician.
Yes. So chronic diseases continue to accumulate. I had a stroke 6 years ago, and with multiple things, I said, okay, I got to do something. I started being strict keto, basically trying to maintain 20, 30 grams per day, lost about 20 pounds by April 2022 to 2023. Then I went a little bit stricter. And in June of last year, I was diagnosed with macular edema. And my A1C at the time was about 6.7%. So I said, okay, I got to become stricter. And even though I had been aware of people that mostly ate meat, carnivores, I was peripherally aware of these people. I said, okay, I started looking into this, found a couple of videos on YouTube. Initially, sounded weird, strange, eating only meat. But after seeing also some doctors, you included, Dr. Chafee, Dr. Berry, Dr. Ovadia, Dr. Kills, I said, okay, I'm going to give it a try. June 29th, I went basically full force and lost another 50, 55 pounds. And I've been hovering since then around 200.
So this is June of 2023, I assume. So a little over a year and a few months ago.
Yes. When we met was June 24, just this past June. So I had lost a total of 120 pounds. I was off my hypertension meds completely. I was in very high doses of multiple medications. Eventually, last February was the last time I took any blood pressure medication. Plantar fasciitis, reflux, chronic pain, improved neuropathy symptoms, nail fungus, a little bit of eczema. It's a long list of things that have improved that. Most of them I didn't even expect. I was trying to bring my A1C down.
Yeah, it's interesting because you've got, like you said, eczema, nail fungus, reflux, all these things that, as a physician, you probably never in your career would have said, "Hey, change your diet to fix your nail fungus." That would have never occurred to you. Correct? Is that fair to say?
Never.
Yeah, and it's what I've seen, and I've seen all of these multiple times occurring in many patients now, where these things that we would not relate with diet. Reflux, you could make the argument, but certainly eczema, maybe to some degree, but certainly nail fungus. Most people say, no, you got to take your antifungals and hopefully not knock off your liver while you're doing it for the oral ones. But so are you still practicing, Nelson? Are you still in active practice?
I'm still practicing. I'm a primary care provider. I'm a family practitioner. I did my residency in family medicine, and that's what I'm practicing right now. I am working in a typical primary care. I'm working for someone else, doing a locums assignment. And it's a typical primary care practice.
Yeah.
I am the only physician with a metabolic health focus basically on the practice. The other providers there are more traditional.
Yeah, honestly, I think it's an emerging specialty. I think we're gonna maybe at some point we'll have its own unique specialty, because just like we have orthopedics and neurology and geriatric medicine, because it's so different from this typical standard of care practice, that it becomes, in my view, more effective, particularly if you have all of the parts that are needed. And then that's something that's why we founded our company Revero, because we have, I think, the support system that's necessary in many ways. But has your experience with putting your own diseases into remission or improvement changed the way you practice to some degree? You see these patients that come in, they're diabetic. God, the answer is easy at this point. Here, just stop eating the carb, not necessarily carbs, but the refined carbs, or well, in many cases, the carbs. How does that impact you?
A lot is the short answer. Since I decided to become more strict, I have become certified by the Society of Metabolic Health Practitioners, Low Carb USA. I've gone the whole 9 yards. I put more CME hours this past year and a half than probably 20 years before. And I always kept with my CME. Nowadays, 80-90% of the patients I see, the first thing I'm thinking is, okay, we need to change the diet. So it has impacted it a lot in the way I evaluate patients as well, and the way I approach the treatment recommendation I'm going to give them. Not everybody's going to follow them, and certainly some people even put resistance, but it has been a major shift.
You're right. Not everybody will follow it, but for the ones that do follow, what have you been able to see?
The ones that follow, always improvement in A1Cs. Even before I had mentioned I have always been giving low carb advice, and I have patients that with A1Cs in the 15s, and I think 15.5 or 16 is the maximum the test can do. I've had patients, a few of them up there. The only ones that I can say that in 3 months probably came back with an A1C of 7 or 6 are the ones who really made the changes to the diet. If they stopped the noodles or the bread or the roots, primarily all the starchy vegetables, I've seen people come back in 3 months with comparatively very low A1C. There is no medicine I've been able to prescribe to anyone, not even insulin, not even, we have about 8 or 9 different groups of medicines for diabetes that we can use. And it's one of the things that I always like, bringing patients under control, but there's no medicine that's going to bring you 8 9, 10 points down on your A1C.
Yeah, and it's interesting because we have more and more medicines for various diseases. Obviously, diabetes, you mentioned there's many classes, whether it's SGLT2 inhibitors or GLP-1s or insulin or to the older drugs and so on and so forth. And yet the incidence of diabetes goes up and up and up and up. And it doesn't seem like drugs are the answer to fix the chronic disease epidemic. You can mask the symptoms for a while, but it doesn't do anything at all to change the prevalence of the disease in any way, shape, or form. In fact, it may even facilitate it in some ways. So back to your own sort of story and your own health, because you mentioned a lot of patients, you said, don't do the diet. And you wonder why won't they do it? Don't they care about their health? What do you think is different about maybe going carnivore versus any other? Have you noticed a difference in satiety, cravings? Is there a food addictive nature to this that you think you're dealing with?
So let me first tell you my personal experience, but we'll talk about addiction in a second. So on the third day, literally third day of just going into, I do mostly beef, but I do eat fish, chicken. And on the third day of doing only meat, I woke up one day and I was like, absolutely, from the moment I woke up, not hungry all day. And I said, okay, wait a second. I'm gonna skip this day. I was already eating once a day, thanks to a negative complication of a GLP-1. I developed gastroparesis or gastroparesis, whichever is your preference in pronunciation. And so I was eating once a day. But that day I went fasting basically. I did a 48 hours fast because I just wasn't hungry. And I really haven't had any problems with getting hungry with carnivore. Now, with patients, sometimes when we talk, you have to meet them where they are. I don't start with them, oh, let's go carnivore, no carbs. Obviously, we talk first about the grains and the bread and the potatoes, the different roots, talk a little bit about ultra-processed foods and why refined sugars and probably refined vegetable oils are not good. And some of them accept it immediately. Oh, yeah, I know it's the sugar, but I can't stop eating my fruits, or I can't stop eating my cereal, and some others accept it and say, okay, I'm going to make a change. Some other people, I'm not going to give up my stuff. And you just insert here whatever it is, because I've had several. Some people can't give up their fruits, but their A1C is 9%. Fruit might not be a bad food, but it's bad for you and me. So I've had all kind of responses. The ones that really rejected they admit, oh, I cannot stop eating that. I'm not going to give that up. I've had 2 patients literally tell me, I'd rather die than change the way I eat.
Yeah, I've certainly seen that. As a surgeon, I can remember cutting off limbs. People that wouldn't stop drinking Coke and they just keep going. And it's just insane to think about that. But when you do, this is controversial. Some people say, well, fruit's healthy and there's no reason to restrict it. But do you see diabetics, when they remove fruit from their diet, their A1C improves? Is that something you've seen clinically?
Yes. And I mean, do you have to all remove fruits? It all depends where you are. If you are metabolically healthy, 100% not diabetic, and you don't have any problems with the 5 main markers of metabolic health, just continue eating what you're eating. If you want to be healthier, maybe you should be avoiding ultra-processed foods. But we all know that there are some people that no matter what they eat, at least for a time in their lives, everything seems to be okay. It's when they start getting older that these habits creep up into changing their metabolic markers. So certainly there are people who eat whatever they want and they're healthy. But when you are not healthy, and especially with diabetes and your A1Cs are not well controlled, You really need to be strict to be able to decrease everything. And if you're going to eat fruits, even if you think it's absolutely healthy and not detrimental to you, the fruits are not going to let you. So sometimes I negotiate with patients. I tell them, okay, have one serving a day of the fruit, only have it after your largest meal, never in between meals, never in a juice. And I give them a little bit of a few rules. And sometimes we can compromise with a serving or two of a quarter to a half a cup of whatever it is they want to have. It's very good also to have them monitor their blood sugars before and after they have a fruit, for example. And of course, having a continuous glucose monitor, it always helps because then you don't have to argue much with patients. I don't like to argue with a patient, but they see right away, okay, this is affecting me.
Yeah, fair enough. Let me go back because you said you went on the GLP-1 and you had a side effect from that drug. What are your thoughts on that? Because obviously there's a lot of people that are on these now, particularly for weight loss. It used to be primarily for diabetes, and a lot of people are taking this weight loss. Well, the manufacturers will say that the side effects are minimal and it's a minor thing, and the risks outweigh the benefits as far as I see the risks. Do you see some level of caution to use these drugs, or is it fine to still everybody takes them and not worry about it?
A lot of cautionary information I give patients. It's not like I never prescribe it. I rarely start people on them. Usually it's because they are already on something like that and we talk about it. But with patients, I tell them, okay, this is going to help this way. You can do it with diet. Almost everything that the GLP-1 do, you can achieve with a very low carbohydrate diet. Even if you're trying to stick with below 50 grams a day or 30 or 20, everything, there's nothing that the GLP-1 medications do that you couldn't achieve with the diet. But for those who are not ready to go there, it does have some benefits. However, most of the weight loss, or a great part of the weight loss, seems to be from muscle. And then when you regain weight, which they invariably do when they stop the medication, if it's being used for weight loss in particular, you regain a lot more fat than muscle. In my particular case, I've been diabetic now for 29 years. Right now, depending on how you want to define it, whether it's remission or reversal, or we probably most agree we don't want to use the word cure, but my A1C is 5.4, and I'm currently using metformin, and the reason for the metformin is I have another medical problem for which I'm still keeping the metformin on board. But I use the GLP-1 for almost 2 years. My A1C before starting the GLP-1 had been 6.7%. My A1C, the month I stopped the GLP-1, it was 6.7%. It had not changed. My weight had not changed. My weight, maybe I could say I had lost 10 pounds on the GLP-1, but I was at the same weight basically. And it did not change until I changed my diet. And interestingly enough, my weight started to come off when I changed the diet. But my A1C didn't change much until I went carnivore. That's when I went from 6.7 to 5.4 in probably 2 months. But during that time, I developed two things from the GLP-1, macular edema, which you could blame the diabetes for that, but I had my eye exams regularly until then. And it wasn't until I started using the GLP-1 that I developed the macular edema, which is one of the side effects of the GLP-1s, all of them. and I developed gastroparesis on the GLP-1. So it didn't help me for my weight, didn't help me for my A1C, gave me gastroparesis and gave me macular edema.
How is your macular edema now? Have you revisited that? Some people will say the carnivore has helped with similar type of things.
About 6 months later, I had a recheck, and it was the same on one eye, and it was better on the other. I have also noticed improvement in floaters and things like that. I am due to have a follow-up on that. I haven't yet.
Yeah, it'll be interesting to see if the other eye also starts to resolve. So that's good to see with that. Mm-hmm. The GLP-1, unable to lose any more weight, unable to improve your type 2 A1C, now carnivore off the GLP-1 because of the side effect. How long because was there, I guess the dosing would be a question, because some people say you're not losing weight, you need to increase the dose, your A1C is not coming down, you need to increase it. Were you at max dose, or where were you at on the dosing on this stuff?
I had been at maximum dose for over a year.
Okay.
And it just had not changed anything. Of course, I was also using some insulin along with that, because at the worst point with my diabetes and my diet, I was using up to 300 units of insulin a day.
Wow.
So I could eat, even when trying to eat the healthiest traditional diet for me. I am from Puerto Rico, grew up eating rice and beans and multiple roots, and all those are pure starch. If I wanted to partake of that, or if I wanted to have my 1 or 2 apple fritters or donuts or whatever, I had to inject at least sometimes 100 units of regular insulin once, twice a day. And then I was using a long-acting insulin over 100 units every day. Past week, I haven't had any insulin. Over the past year, not past year, I stopped using insulin in December. I've gone months without and using a little bit here and there because my pancreas is not producing as much. So my C-peptide was low. All my antibodies are negative. So I did not turn into an autoimmune type 1. Just my pancreas after 28, 29 years got exhausted.
Okay. And so you say your insulin usage is basically none to very little at this point relative to 300 units a day, right?
Yeah.
Yeah, that's got to.
Past week or two, I haven't even used any. Yeah.
Interesting. Yeah, that's awesome to see. That's got to feel pretty good to not have to inject yourself every day or multiple times throughout the day. So you have a physician, I assume, correct? And you have a physician that prescribes you this. Is that fair to say?
Yes. I'm off the GLP-1. I'm off the insulin. I have plenty in the refrigerator, but I do have a primary care provider, yes.
Is he aware or she aware of the fact that you're now carnivore and lost 100 pounds? And has there been I'm sure you've had discussions if you talk to that person.
They are, at least marginally. The thing is, I've had this experience with my primary. I've had this experience with the cardiologist. I've had this experience with the neurologist. Even the cardiologist, the only thing he wanted to know about was, is your LDL under 70? He's someone who's known me for 28 years. He saw me at my maximum weight. And after losing over 100 pounds, he never even asked how I did it. My neurologist, though, I have to give him credit. My neurologist, when he saw my A1C one time was 6.7, he said, Nelson, you have to get that lower. Yeah, I mean, he definitely was more concerned about the A1C than he was about whether my cholesterol was X or Y or what the number, or whether I was taking a statin at that point. He wanted the A1C to be lower, which none of the other ones really addressed that much. Because why? 6.7 for the traditional doctor is
good control.
Under control,
yes,
right?
That's good control under 7. Yeah, exactly. What was a neurologist doing? I don't remember hearing a neurological disorder. What was a neurologist involved in?
So I had a stroke 6 years
Oh, yeah,
ago.
of course. Yeah, sure. Yeah.
And then, so from that, I have paresthesias. I had also had 37 years ago back surgery. I had a lumbar laminectomy. I believe it was L4, L5. But a couple of years ago, I had developed a severe lumbar spinal stenosis with neurogenic claudication. I was having difficulty walking. I had fallen a couple of times, couldn't walk more than maybe 50, 100 feet without any assistance. I was using, when I went to the stores, I would get in one of those electric carts or always had a cane with me. The only place I didn't use the cane was to go to work because usually within the office, if I needed, I could hold on to the wall. So didn't people didn't see me using the cane then, but I was at a point that I was on my way to a wheelchair basically. As the degenerative changes in my spine are still there, I have no pain. I have improved my neuropathy. I had B12 deficiency as well, and I have diabetic neuropathy. I had the stroke with paresthesias, and I had a S1 damage from before the surgery because of a severely herniated disc. So I had multiple reasons to have numbness, tingling in my feet, and that has improved. It's still present. I still have some of that, but I was at a point where I wasn't almost feeling my feet at some point, and that was causing problems with walking. And like I said, I had fallen a couple of times. So that has improved tremendously.
It's good to hear all those things. The back pain, which is probably, you would probably thought you're stuck with that the rest of your life. A lot of people say you've got this degenerative disc disease or you've got this arthritis and there's nothing you can do about it other than maybe spinal fusion or depending on where it is or joint replacement, if it's a knee or something like that, knee or hip. And so that's got to feel good. How would you rate your health today versus what it was, I don't know, 2 years ago before you went carnivore?
It's incredibly different. I multiple chronic things that were going down, and everything is improved. Some of them eliminated because metoprolol, for example, it was one medication I was using 300 milligrams a day plus lisinopril 40 milligrams a day. I'm not using any blood pressure medication. My blood pressure sometimes dips a little bit under 100. Usually it's 115. When I'm having a bad day and I even don't feel good, I think, okay, my blood pressure might be high. The highest is 130. And other minor things, and I call them minor because plantar fasciitis, even though I had it for on and off for 30 years, plantar fasciitis, I don't think it ever killed anyone. It is bothersome. If you've had it, you know that it hurts a lot. Haven't had any more problems with that, with the reflux, which was a chronic problem. For 30, 35 years, I took one of the medication. It could have been Zantac or Pepcid or Prilosec or Prevacid. Any sample I could grab from the sample closet would be my medicine for the day. And I don't take anything. If I rarely have a little bit of I feel a bit of acidity or anything, I take half a teaspoon of bicarb with half a cup of water, and that's it.
Yeah, that's pretty amazing. So I would say you're probably now, would you call yourself a believer in the diet that is capable of changing things?
Certainly. Now, when I see a patient, I'm thinking, okay, multiple diagnoses, multiple medications, and you could eliminate 80, 90% of those medications and of the conditions, improve them or eliminate them in probably 80% to 90% of the patients and 80% to 90% of their conditions and medications. It can be done. I show them what I've done, not to brag, but listen, I am a regular person. I happen to have gone to medical school, but I'm a regular person. I can do it. Before we mentioned addiction, you mentioned a little bit, and that is a real thing. I don't think you have food addictions, but you certainly have carbohydrate and sugar addictions. The reason I say food addiction, everybody needs to eat something. So if I'm addicted to something right now, it's to steaks.
Yeah, I'm too. I have that addiction as well. Yeah, I think so. Well, it's interesting because some foods, and I would say that not a lot of people are eating bags of sugar, but a lot of people sugar added to foods. And you think about it, if you eat this chocolate with no sugar, dark chocolate, no one will binge on that. But you put sugar in that chocolate and all of a sudden it becomes bingeable. And I think that's the difference there, that some of these ingredients are hyper, and they're designed this way. Food companies absolutely know that's why sugar is basically in every damn food we have. That's why is there sugar in, there's salt that has sugar in it now, which is bizarre to me. What has been, let me ask you this, because it's always fair to ask these questions. Have you had, since switching to a carnivorous diet, negatives? Have there been anything negative about it?
Initially, adapting to going number 2 sometimes became, when I was trying to increase fat, it became too loose. It's a matter of adjusting, basically. I don't think I can say that I've had my energy level is incredibly better. So there have been some periods where I couldn't even sleep too much. But that has not been a permanent thing. I really haven't had any negative side effects. The only time I felt any type of fatigue or tiredness usually is because I wasn't paying attention to having enough salt. Going from previously having hypertension, having had a stroke, and always, because my mother was hypertensive and she always watched her salt, I grew up not eating salt. I was always paying attention to the amount of salt. Now I need salt, and if I don't have enough salt, I feel it in my level of energy.
Yeah, fair enough. And because I guess this is a point, because you are a primary care physician, you run into this quite a bit. You see a lot of patients that have quote unquote dyslipidemia, hypertension. We've been told we should be eating a low fat diet primarily. We should not be salting or minimizing the salt. A lot of the salt we consume comes in the form of processed foods, which I think that is probably the biggest confounder in my view. But what are your thoughts around those things now? Should we be restricting salt? Should we be eating low fat? Obviously, your personal experience would belie that. But what are your thoughts?
Definitely low fat shouldn't be the way to go, even if some people who go low fat and low whole foods and watch their calories, they might achieve some success with the diet and their medical conditions. But when you're trying to restrict fat, you have to still eat, and you're going to have to substitute it with something. Hopefully the protein stays at a good amount, but the carbohydrates are going to increase. And especially if you're dealing with disease, that's not going to be good. I also, ultra processed foods. I have turned around completely. I mean, first of all, I view those, almost anything that's ultra processed, I view it as poison, and that's the way I keep from even reaching for it. Ultra processed foods. I keep a healthy snack bar in my pocket in my white coat, just to show to patients the first 7 ingredients of, I'm not going to mention the brand name because they are all the same, but the first 7 ingredients, 5 of them turn into sugar, 1 of them is salt, probably the only healthy one, but in combination with everything else, the whole thing is not good. And then canola oil, which, I'm writing a little book on canola oil because it's the example I give for the vegetable seed oils. I don't know if you're very familiar with the history of canola oil, but
yeah, it's rapeseed oil from Canada oil or something like that. Yeah.
Yeah, yeah. A lot of people are surprised when I mentioned that canola oil just means canola acid. It's the rapeseed oil is very high in erucic acid,
Mm.
52% of what comes of that original seed. And that acid, that oil, is toxic to human hearts. So until 1974, it wasn't used. When they finally manipulated the seeds, basically through breeding techniques, which is a form of genetic manipulation. We've been manipulating plants and fruits for thousands of years. We didn't know we were manipulating their DNA, but finally in 74, they were able to produce the oil, what's now called canola oil, which still has, it's allowed to have up to 2% of that urucic acid. I always have problems pronunciating that. And it's currently used as biodiesel. It's very high on omega 6, omega 9s, not enough omega 3, so it's got an inflammatory profile, even though it says heart healthy on the label. And before 74, it was used as a machinery lubricant. It's motor oil.
Yeah, we've seen that. It's interesting now because a lot of people are starting to realize that these ultra processed foods aren't good for us. And yet there are physicians out there still saying there's nothing wrong with ultra processed foods. You can still eat them in moderation, or some are better than the others. What are your thoughts on that? Should we just completely eliminate them? Would it make sense to do that?
I think we need to completely eliminate them. But I do understand a lot of people, for example, would like to have more studies. If we have some limited amount of studies, so far the studies, unless they're sponsored by the big companies, usually they're not positive. There's nothing good about ultra processed foods. I always say I have apologized to my children for feeding them healthy cereals in the morning with skim milk so they could go to school with a high on sugar and perhaps not enough protein and fat in their food.
Yes, that is how I know as a kid, I woke up as a bowl of Trick cereal or Count Chocula or something like that. That was the way I started my days. And I think in retrospect, probably would have been better had I not done that. But so you're in Florida. Obviously, there's at least a little bit of political discourse around the food. There's a so-called Make America Healthy Again sentiment going on out there. Again, I don't think we can ban foods. I think that's probably, I don't know if I would say that. There may be some ingredients that are so egregious that it might make sense to ban them. Like I said, there's a lot of foods and there's a lot of ingredients, I should say, in the U.S., foods that are illegal in many other countries. It might make sense to pursue some more of that tack, but I don't see us banning potato chips or anything like that, nor would I recommend it. But we've got to educate people not to eat it. And if we stop eating those things, then they will just magically disappear because no one wants them. And that might be the way to approach that. But what are your thoughts on the sort of? Do you feel that? Do you feel that we're going to be able to that the government is going to somehow make some big change that's going to fix everything?
I don't want to be pessimist, but it's going to be difficult when you have the economic forces of big food, big pharma, big agriculture who want to continue putting huge amount of grains into foods and huge amount of sugar, and they make money out of selling all this ultra processed food. And there is very a in comparison a very small number of people talking about this. I know the last week or the week before there were some hearings in Congress about food, and there's going to be a march in Washington D.C. in a little bit. I think Dr. Hampton is one of the people spearheading this. It's going to be an uphill battle, but if you're interested in your health, and of course, I'm probably preaching to the choir to whoever is listening to this, but if you're interested in your health, you probably need to eliminate all ultra processed foods from your plate, from your pantry, and all refined sugar, all refined seed oils, and then pay attention to the food that you put in your mouth. And for some people, a whole foods omnivorous diet might be okay. Some other people who are metabolically not healthy might need to continue to go down in the restriction escalator down to whatever is healthier for them. So the battle to eliminate bad foods, it is a difficult one, and I don't want to be completely pessimistic, but it's a uphill battle.
Yeah, it's about worth doing, though, and I'm optimistic that we can make a difference. Dr. Nelson, thank you very much. I have to head off for another meeting here. Thank you for participating, sharing your story. Continue success on your journey, and I'm glad to have another warrior in the battle here, because that's what we need. We need more of them. So thank you very much for doing this interview. Appreciate it.
Thank you.